Hello again. This is going to be the part of my history and physical that has to do with the female genitalia examination. The first thing you're going to do, of course, is have the patient lay in the lithotomy position on the examination table. You're going to inspect the pubic hair, make sure that it's well distributed, no nits, lice, nothing like that. You want to make sure that the skin is smooth and clean. The labia majora will be gaping or closed, and dry or moist and symmetric. The unilateral swelling, any unilateral swelling or redness or tenderness, it could be a Bartholin gland abscess. We want to look for any excoriation rashes or lesions which can indicate an infection or inflammatory process. You're going to look for discoloration, varicosities, stretching, or signs of trauma or scarring. You could, of course, ask the patient too if she's been itching. Tell the patient you're going to touch her. Tell the patient you're going to touch her, and you'll touch the thigh. Just moving along to the external genitalia to separate the labia majora and inspect the labia minora. Then separate and inspect and palpate the inside of the labia minora, the clitoris, the urethral orifice, and the vaginal introitus. You're going to note any redness, swelling, lesions, or discharge. The clitoris is usually approximately 2 centimeters in length and 0.5 centimeters in diameter. You're going to observe for any atrophy, inflammation, or adhesions. The urethral orifice is an irregular opening or slit, and you're going to, at this point, you're going to inspect for any discharge, polyps, caruncles, and fistulas. The vaginal introitus will be thin vertical slit or large orifice with irregular edges and can be moist. No swelling should be noted, no discoloration, discharge, lesions, fistulas, or fissures. None of those things should be present. Now you're going to tell the patient you're going to insert a finger, and she may feel some pressure. With your palm facing up, you're going to insert the index finger up to the second joint of the finger and apply upward pressure to milk the skein gland by moving the finger outward. You're going to perform it on both sides of the urethra, then directly on the urethra. There shouldn't be any tenderness or discharge with this. If there is any discharge, it usually indicates a gonococcal infection. You're going to locate the cervix, the direction of the cervix for the insertion of the speculum. With the finger and thumb, press the vaginal opening. You're going to feel the perineum and Bartholin glands. There shouldn't be any swelling or tenderness or masses or fissures or lesions or growths or sign of infection. None of those things should be seen. You're going to ask the patient to squeeze the vaginal opening around your finger, explaining your testing muscle tone. Then you're going to ask her to bear down as you watch for bulging and urinary incontinence. Bulging and incontinence indicate cystocele, while posterior wall bulging indicate rectocele. Protrusion of the cervix or uterus displays uterine prolapse. The perineum should be smooth, and a scar may be visible from childbirth. The tissue will feel, it will be thick and smooth in people with no children, and rigid in those who've had some children. The anus is darkly pigmented and coarse. There should be no scarring, lesions, inflammation, fissures, lumps, skin tags, or excoriation. Now, as far as the speculum goes, you're going to want to warm the speculum with water, or hold it in your hand and lubricate with water or a water-soluble lubricant. You're going to ask the patient to relax and take a deep breath to relax the muscles. With the index finger on the top, you're going to insert the speculum in the direction the cervix was palpated so that we avoid trauma. Press the thumb piece to open and lock it when cervix is exposed between the blades. So when we inspect the cervix, we're going to look for color, size, position, Discharge and the shape. The cervix should appear pink and smooth and 3 centimeters into the vagina with midline angle. Blue cervix can indicate pregnancy, while a pale cervix could indicate anemia. Red, patchy, or irregular borders are abnormal. If the cervix deviated to the right or left, it could indicate mass, adhesions, or pregnancy. If it's protruding greater than 3 centimeters, it may indicate pelvic or uterine mass. Retention cysts are an expected finding unless swollen with fluid, and distortion of the cervix is noted. Let's see. Discharge should be odorless and clear in color. Bacterial or fungal infection produces odor and a white, yellow, green, or gray discharge. The os is small and oval and round in those who've never had any children, and horizontal slit or irregular in people who've had children. The speculum is unlocked and removed slowly and carefully with inspection of the vaginal walls as removed. So when you do all of these things, you of course want to make sure you gather all your specimens for any pap smears or cultures or labs that you need to do. Now when you do a bimanual examination, you want to lubricate the index and the middle finger. You're going to let the patient know what you're doing, of course, and you're going to spread the labia and insert index and middle fingers into the vagina with your hand facing up. Place the other hand on the lower abdomen, palpating the cervix with the index finger, noting size, shape, and consistency. You're going to gently move the cervix side to side between the fingers and note any mobility and tenderness. You're going to gently lift the cervix forward and note the mobility and tenderness at that point as well. When lifting the cervix, you're going to press downward on the abdomen and palpate the uterus if possible. You want to note the consistency and any tenderness while attempting to estimate the uterine size. It should be pear-shaped, about 5.5 to 8 centimeters long, rounded, firm, and smooth. Pull back the vaginal hand to clear the cervix and reposition to right fornix, palm up. You're going to sweep the right ovary downward with the abdominal hand 3 or 4 centimeters medial to the iliac crest. You're going to gently trap the ovary between the fingers of both hands, if possible. You're going to note its size and shape along with any other palpable adnexal structures. You're going to pull back and repeat on the left side. The ovaries should feel firm. They should be smooth. They should be 3 by 2 by 1 centimeter in size. And they should be lightly to moderately tender upon palpation. No adnexal masses should be palpated. So let's see here. I think that is about it. Thank you so very much. I hope you have a good day.